Life is an amazing institution here in the North East. It's a science village and it's an amazing part of the fabric of the city. We have the NHS here, we have Newcastle University, we have a science centre. 500,000 people come through the doors every year. They may attend an exciting event in the square, they may go ice skating, they may come and visit the centre, they may actually work here. Partnerships at Life are really important. We have the NHS and we have the university on site. We're so lucky to have a resource and have a fantastic place and a fantastic science centre here right in the centre of the city for the region. It is very difficult to find someone in the North East who hasn't had some sort of visit here over the last 20 years.
People are aware of what it does because of its geography, because of its interaction with school children. And I can't believe that that won't have led many to have got into science and careers in science because of that early exposure. Being proud of the fact that you're in a city that's got a long history of innovation. You've got this real living and breathing example of world-class medical research going on in front of your eyes. It's held in great esteem by lots of people in the North East, no doubt.
Life has really become a jewel in the North East crown. We've been here for over 20 years now, and I think it means something to everybody in the North East of England.
Actually one of my very favourite places in Newcastle because of its serious science research, but also because it does something which I think is so important, which is to communicate and engage with young people about science as well.
Right from the start, the Centre for Life was about bringing together service, academic, teaching and business. Having a fully integrated academic health service community means that we draw on the strength of having that huge population in the north of England especially, who are very supportive of giving their samples to do research, and also the rigour, if you like, of the pure scientists who are trying to sort of take it to the next level.
My team is researching eye diseases, and we are investigating how eyes are formed during our embryonic development. We are very passionate about how we can bring vision back to patients that are blind or lost most of their vision. So we've got this fascinating project in which we can use these very early stem cells to make little organoids which mimic how the retinas, which sit on the back of the eye, process the light. So by having this retinas in a dish, we will be able to understand many diseases. This has really been a truly exciting project, has resulted in all these patients regaining their vision and their quality of life. But it's also been wonderful for us as scientists to actually see directly the fruit and the results of our work.
We set out to find people who had a genetic predisposition to cancer in order to try out different ways of preventing the cancers as opposed to treating them. And we recruited 1,000 people across the planet in 16 countries to take interventions, one of them being aspirin. And the aspirin had turned out 10 years after we finished treating them, their cancer rates, their bowel cancer rates are reduced by half.
My mother was one of 9 siblings. 7 of them died of bowel cancer between the ages of 42 and 56. My mother, I think, was the eldest at 56. And it was identified as Lynch syndrome. If you have Lynch syndrome, you're more predisposed to certain cancer types, especially bowel cancer. Once that was identified, the Centre for Life contacted us from the cancer prevention team, and since then we've been in close contact and have done various trials over the years. I believe that if it wasn't for the research that's carried out at the Centre for Life by Sir John Byrne and his amazing team, then I probably wouldn't be here giving this interview today.
We've been here right from the beginning when the building opened, and so we have many children now who are adults who are all celebrating their 21st birthdays around about this time. There's a huge advantage to being here, apart from just being in the complex. We're part of a vibrant community of things going on. There's research, there's the genetics department, and we've always been part of that community, if you like. The reason people travel from elsewhere in the country is for some of the highly specialised services. So one of those is the andrology service. This deals specifically with male factor problems, where men have testes that aren't producing sperm readily, and so we have surgical sperm retrieval techniques that will help in that setting. We can collect the sperm, use it through the IVF service. We're one of the few centres in the country that incorporate that service properly into the fertility programme. The other is the mitochondrial service. We're the first centre in the UK to provide pre-implantation genetic diagnosis for mitochondrial disease. We're the only centre in the country to have a licence to undertake mitochondrial donation treatment.
Been to the exhibition space, I've been to Christmas parties there, for example, and all sorts, and I watched the football there in the World Cup, but I never thought that they would be responsible for bringing my child into the world, not in a million years.
All in all, it was probably about 5 months from being seen to actually finding out I was pregnant, so not long at all, really. The staff there were wonderful. If I ever had any questions or worries, from start to finish, I could ring them. There was an on-call doctor I could speak to for any medical advice. They were just absolutely fantastic. They were just there for you every step of the way.
We've had a very, very varied and exciting programme of exhibitions coming to life. Some of them have come from elsewhere in the UK, some have come from overseas, but I think that probably the best one, the one that really seemed to excite everybody, was Body Worlds. During the Body Worlds exhibition, we had our highest visitation levels ever, and people were coming not only from the northeast, but they were coming from the north of Scotland and even as far as Cornwall. So it really, really, really did put Newcastle on the map and excited everybody. But there have been other exhibitions as well. We've had exhibitions on video games, and we were also the first city in the UK to host Maker Faire, which is a bringing together of people who love making things. So we had dozens and dozens and dozens of makers coming from all over the UK again, but as well from countries in Europe and in North America. And it really does inspire kids, and it certainly inspired us to have a making studios of our own where kids can come in regularly and tinker about and make things. We're very, very lucky indeed that the Science Centre has access to real scientists, real researchers who are doing groundbreaking work. We bring these scientists and these researchers into the Science Centre on a regular basis so that they can talk to our visitors about their work, and our visitors can ask them questions. Thousands of school children visit LIFE on an annual basis. We have a suite of laboratories where they can do practical hands-on experiments, and this is a great boost to schools because not all schools have laboratory facilities on site to be able to do the vital practical work that many students need as part of their courses. It's also really important to us that we have those scientists and researchers as role models for kids, because they are an inspiration and an examples of being able to get a rewarding career in science, which is interesting and well paid if you stick in with STEM subjects. We've had a long-standing relationship with the NHS, and it goes back to 1998 when they set up their fertility clinic and also a clinic for people with rare genetic diseases. And so when COVID hit, it seemed quite a logical evolution of that relationship with them to think about using the Centre for Life, our science centre and our meetings and events space as a large vaccination centre. And we were the first science centre in the world to actually be repurposed as a vaccination centre. And I think it's been a really good fit for LIFE. It works really, really well with the Science Village concept.
I think the Centre for Life kind of came to the top of the list really very quickly because of that long-term relationship. But actually then beyond that long-term relationship, you look at its geographic position, you look at its communications and the ability to get transport to here. Its central location in Newcastle, its links to science, and what we were doing was a scientific endeavour, healthcare endeavour to care for the population. All those things just kind of came together and everyone went, well, yes, of course, Centre for Life is the right place to put a vaccination centre. In March, we had a special live BBC news special with Naga Manchetti and Nick Robinson. So it was great to have them here in this particular vaccination centre, many NHS staff involved in that. And of course the centre team here were just overjoyed to have the BBC and the spotlight shown on them and the great work that they've been doing.
What does the future hold for life? It's a really difficult question to answer, but if the next 20 years are as eventful and exciting as the first 20 years, then I think we're in for a really, really exciting new chapter in the life story. We will continue to discover new techniques and new breakthroughs to help people live longer and healthier lives. And the Science Centre will play a really, really important part in that by engaging people with this new science, which is helping to shape all of our lives.